from the Broadcast Center in Los Angeles, this is KCAL 9 News at 7 a.m.
And in our red room, we have Dr. Lisa Curcio. She's a surgeon, and she's going to talk about Breast Cancer Awareness Month. She will join us in studio next. October is Breast Cancer Awareness Month, so this morning we're talking to Dr. Lisa Curcio. She's a surgeon and director of breast surgery at BreastLink. Good morning. Thank you so much for joining us, doctor.
Good morning.
Thank you. I have to say that it was 1 year ago today that I was diagnosed with breast cancer, and I also know that you are a breast cancer survivor, but you were diagnosed much younger than I.
Correct. I was diagnosed at age 37. I had a 9-month-old child at the time that I was diagnosed.
Wow.
We're one of 3.3 million breast cancer survivors out here in the United States.
But once we hit 40, we have those mammograms every year, but you hadn't reached 40. So obviously I'm guessing that your thought is that we need to get them earlier.
Well, we certainly feel that screening should start at age 40. For some women, if they have a family history, it should start earlier. I did not have a family history, but what I did have was a symptom. I actually had some bleeding, and that prompted me to get a mammogram, which saved my life and diagnosed my breast cancer.
Yeah, I think that's one of those false misnomers that people think if it's in your family, you're going to get it, but if you don't, I also did not have it in my family. I am the first. So I think we can't think that way and kind of ignore symptoms.
Absolutely. 75% of the patients we see diagnosed with breast cancer do not have a family history.
Wow, you really need to be aware. But you were 37 and you were in the military at the time that you were diagnosed. How did that kind of impact things?
Well, you know, being treated wherever you are, you know, you really worry about the standard of care. But I can honestly say that I got excellent care in the military. Ironically, I was part of a big DoD initiative at that time to improve breast cancer care in the military. And so I was able to benefit from a program that I was instituting at our facility. I actually was stationed in Biloxi, Mississippi at Keesler Air Force Base. And so I really feel that through that initiative, I really got excellent state-of-the-art care for my breast cancer.
And that's made a difference for women now, today as well.
Absolutely. And the DoD continues to invest money. More so now, the money's going towards research and partnering with scientists and consumers to improve the care of breast cancer patients and to hopefully eradicate breast cancer in the future.
Okay. And, you know, I feel like there's so many misnomers, and this month people really need to be thinking about it. Is there, if you could give advice to women at this point today, what's the best advice you give to women who might be?
I think the best advice is to be proactive, to examine your breast, and if you feel something, go to a physician. And if you're young, sometimes the physician might say, you're too young, you don't need a mammogram. Really push and be your own advocate and actually insist on some kind of imaging, starting off in a young woman with an ultrasound and maybe ultimately a mammogram. But you have to be your own advocate.
Exactly. And I think one thing that I was really confused on is that when I received the call, I didn't even know what to ask. And I think that it's so important that women at least know when you do get that call, that doctor who calls you may not tell you what you need to know, but you need to find out what size it is, first of all, so you can figure out what stage you're in and do a little homework so you can figure out the best doctor.
Well, at that point, you not only become a patient, but you're a consumer.
Yes.
And just like if you were going to buy a car, you need to research your physicians, you need to research what you need to know to be able to make an informed decision.
Absolutely. Doctor, thank you so much for joining us.
Thank you.
Love to meet another survivor. That's always wonderful. Thank you so much for being here this morning. And to learn more about BreastLink, just go to our website, kcal9.com, and click Seen on TV.